Hi guys, alright, so I wanted to talk about my birth plan. I know so I'm definitely sounding, because I just uploaded my 32-week update, and it's been late because I haven't felt great. But I know I've been talking about my birth plan. As many of you guys know, we did originally want to do a VBAC, but we were told, of course I had to meet certain qualifications, and also I need the high-risk doctor to say A-okay. That was at 20 weeks that was supposed to be determined, meaning as long as everything looked good. But we found out at about 16 weeks that I had a placenta previa, which that automatically takes a VBAC completely off the table. But he did agree that if things looked better, and that actually the latest that he could go is 32 weeks. It'll completely come off the table when I have my appointment on Monday. He already said that more than likely because of the placental abrasion, because of the anemia, and the constant bleeding that I've had, he doesn't feel safe releasing me to do a VBAC. I have gotten a second opinion about it, and because he did send my records up to the hospital that actually can do it, and just said, look, would you guys recommend this patient for a VBAC? And they've already come back and said, it makes them a little nervous and uncomfortable. They said so they would really. I'm not a great candidate, but I could still do it if I really, really wanted to do it. So after talking with a couple of people, mostly my mom, just because I wanted, really wanted her opinion, and like she said, as much as a VBAC would be great, because the reason I want a VBAC is because we've had so many issues breastfeeding, and I can't help but feel that it could be because of the C-section, because when you're in labor, there are hormones that are released that kind of help trigger milk production. When you have a C-section, those aren't necessarily released. For some people they are, especially if you have had an emergency C-section, because then you've actually had some of those hormones released. But when it's a planned C-section, sometimes those aren't released right away. So, yeah. So, and there's controversy on that women that have had C-sections, that their milk takes longer to come in, and blah blah blah. It's kind of like the placenta encapsulation. There's the ones that go, oh, it helps, it doesn't help, it doesn't. Yeah. It all depends on who you talk to, and this and that. So this is my birth plan for a gentle C-section. This is what makes me okay with having a C-section. And most of it has been approved. Like I said in my video, that I had to talk with the doctor to find out exactly what was going to be approved. So it just has, the goal is a more relaxed personal experience post to a medical medical surgical operation. And that's just my main goal. I did it that way so that way they would really understand the main point of it is I just want it to be relaxing. I don't want it, you're already nervous enough, so I wanted it to be more relaxing. To achieve this, first thing I would want is, well, I have a husband, but I don't know, it might be somebody else at this point. Would like to have husband hold, I'd like to have my husband's hand during the spinal. For some reason, when I had the spinal put in with my son, I was very relaxed because I didn't know what to expect. For me, it hurt really bad. So when I had my daughter, then I started, actually started shaking, and they're like, you need to stay still, and I was trying very hard. So I just wanted, somebody, because unfortunately, at least the two hospitals that I've had them done, the policy is the husband is not, or your partner is not allowed in there until you've had the spinal put in, you're on the table, and basically they're ready to go. So I said, can I do that? And actually that was approved. The anesthesiologist said, if it's going to keep her calm, then it makes sense. Low, calm voices. And I did put, unless medically needed for my safety or the baby's safety. Just, if you have a lot of, I don't know how to explain it really. When I had my son, everyone was pretty quiet. When I had my daughter, it wasn't very quiet in the room at all. And I just really want calm voices. So that way, if they're starting to get loud, I know something's wrong. No outside off-topic conversations. And I put that it makes it easier for me to relax, and I don't want to hear about weekend plans. When I had my daughter, it was right before Thanksgiving, so unfortunately what happened is that I had a lot of, I don't want to say I had a lot of the nurses, because it was the whole, like almost the whole room except for the doctor who was doing the C-section. They're all talking about, oh, whose house are you going to for Thanksgiving? Oh, I'm going to this one. I got to make this and I got to make that. It was very hard for me to concentrate on what the doctor was saying. So my doctor said, yeah, she's like, it's really kind of unprofessional. I'm like, yeah, well, it makes me feel like I'm just there, but not there type of thing. So I don't like it. So next thing is drape lowered, so I can see the baby coming outside instead of having to wait to hear baby cry. And I put that I wanted it done at the beginning. Now the only thing is my doctor, she's afraid of, because she's like, well, some people, they see a lot of blood, they pass out, and I explained I'm not. I watched the whole video of them doing my hip. It did not make me sick. But the compromise is, because I explained to her too, when it's way up high, I can't see her face. Granted, you can't see their face anyways, but I want to be able to kind of, where I can watch her, because she's very expressive with her eyes, so originally what she wanted is, like, right before the baby was taken out, they were going to drop it. So what the compromise now is that it's only going to be raised up to where I can see her, but I can't see what she's doing. And that's going to be done while we're waiting for the spinal to really kick in really well. So that way, we've got the eye contact. And then right before she's born, they're going to, because they get everybody kind of ready to, okay, we're going to have a baby now. At that point, they're going to lower it. She's like, so unfortunately, she's like, you're going to see us pushing on your belly and everything like that. And I said, I'm fine. I said, it's better than waiting for that cry that, I want to hear so bad. So they're okay with that. Next thing, with a nurse's help, I want to hold the baby as soon as baby is born. But I understand that this might be hard to do because of my arms. Most of the time they keep them straight out. But it's important to me to give baby their first hug. And I did explain to them, especially now with everything that we've gone through, I really do want to give that first hug. Like, I just want to hold her right away. And of course, the doctor's like, well, she's going to be kind of icky and, she's like, you're going to get dirty. She's like, so we're going to have to take off they have to take off the hospital gown, and I said, well, but you guys have to take it off anyways, right? And she's like, true, we take it off to do skin to skin. I said, well, then, they're gonna have two, after I explained that, and she's like, okay, well, makes sense. I did say that I do understand if she needs to be rushed because of whatever. Can I squeeze her foot, because they're going to actually do all the assessments in the room with me, and it's a very small room. They're going to do it that way, hold off on giving her her first bath and everything like that for a little bit, just so that way I can, I can still be with her and everything like that. But what they're going to do is have two of the nurses help me hold her during it, and then as they're stitching everything up, they'll because her fear is that she's like, you're gonna you might try to tighten muscles or things like that, so I'm only gonna be able to hold her, really give her one quick little hug, and then they're gonna take her, but she'll be right on the side of me the whole time. And they'll do all of her assessments right there, so I can still watch her and see her. And they're going to sew me up, and then because I am making my own hospital gown, because I couldn't find one that I liked, so I am making my own. When we do the skin to skin, at that point, they're going to put her, because they put me onto the bed that's going back into my room. Then they put her on me, and then they're going to put the hospital gown that I made over the two of us. So I will be able to hold her right away, which is a lot different than what a lot of hospitals. So that is something, if you're looking into a gentle C-section, that might be one of those things that your hospital might not even allow. But then you can say, no, look, I really want to be able to touch, and that's what I said. I want to be able to touch her foot, touch her hand, something other than just you guys bringing her right here to me. Oh, hi, baby, I can touch your head. I said, no, I want to hold her right away. Right away, because with everything, it's just, I want her. Delayed cord clamping, that they're going to do as long as the cord is long enough. And everything is okay. And I said, I'm okay with you. I don't care if you have to throw this whole thing out because of, I want whatever's safe for the two of us. So they said they will do that. That during the opening, meaning during that time that all you can do is sit there and wait, if we can have calm music played. And they said, well, we can't bring in a CD player. I said, what about my iPhone? And they said, well, we'll have to put it in a bag. They said, so it's sterile. And they said, as long as it's like all prompt, where all you have to do is try to like press play, they'll do it. So they're okay with that. The skin to skin, of course. And then the placenta encapsulation, unfortunately that's come off the list, because the woman that was going to do it will not do it with the placenta, with the placenta abrasion and also the anemia. She said no, which is kind of frustrating because she's the only one in this area that will do it. So kind of sucks. The hospital is trying to help me find somebody else that can do it. They said, the person might be all the way from Massachusetts and things like that. They're like, so you might actually have to pay a little bit more. And I've decided that if it doesn't, these are things that I can't prevent. So I'm okay with it not happening. I really want to do it because I did, but whatever. So that's it. I'll talk to you guys later. Bye.